Yes, my friends, wherever you are, my learned friends, my colleagues, and everyone. Today we have a very funny question, like the topic says. I get some questions that I sometimes kind of like fail to answer or be confused to answer, but today we need to answer this question because many people take drugs and they are confused on what to do when they are taking these drugs. Hmm? It's very important when you are written a prescription by a doctor, this doctor to confirm to you this is your problem and these drugs are treating you this way. The adverse and the effects of these drugs. You get it? It's very important, and sometimes it's not good to ignore this. If some people are they fear doctors, they fear anyone in a white coat, and everything that this person is told, he takes it with fear. But nowadays, thanks to technology and everything, people have started doing things the right way and they ask questions, people go online, they Google, and information is everywhere. Like you see, right now we are interacting. Yeah? We are telling each other what to do and what not to do when you have drugs. Hmm? What to expect when you take such a drug. You see, it's very important to talk these things out and know. Sorry, I'm setting up some things as we continue. It's very important to know these things and to at least get to understand how these things work. Now, mhm, there are so many things that we do, and there are so many things that we we as professionals we don't follow up, like explaining to a patient what you should be doing, like telling a patient this drug will act on you like this and you expect this, and if you don't get these results, please come back. We just write prescriptions and send you to the doctor's office, to the pharmacy, sorry. uh, as we talk, if you have any question that you really need to ask, you come and online and ask, or if it is a private message, you just send me an email. Now let's get to today's topic. The other, it was just a refresh. Now today's topic says, mm, should you finish your medicine? Should you finish your medicine that you've been given by a doctor or a medical practitioner? You know, some prescriptions are written for a specific duration, including dosage and the time. When we write like 2 times a day, every day for 7 days, it means you can get well through this time period. And it's important to follow those prescriptions, mostly when it comes to antibiotics. Antibiotics often need the full prescribed course. Why? Because antibiotics simply means antibacterials. They take course on bacteria. They kill bacteria. And if you don't complete, what will happen? If you don't complete, what will happen is you minute minute is happening. Some setups here are bringing complication, but now being set, being set. Let me see here. Here. Yes, let's continue. Let's continue here. Yes, I was saying it may lead to something called resistance. You get it? It may lead to resistance, and resistance is not a good thing. When you get resistance, you can have so many problems. Resistance of antibiotic means you go to another higher antibiotic than the one that you are taking. And the more you go to a higher antibiotic, it becomes more expensive and more hard to treat. You get it? Hmm? Incomplete course may incomplete course of antibiotics may fail to fully clear the infection. Antibiotics, you must clear them. It means you may get some bacteria that are not cleared, or some cysts. We call them, the general population knows them as eggs, eggs that are not cleared. And I've talked about resistance. You know, as you take the antibiotic, the bacteria that are in you, they are learning how to evade their effect. So if you don't take the full course and you take them partially, they learn how to evade the drug so that you can heal. You get it? If it's a bacterial infection. Hmm? This is more, especially in TB, typhoid, deep-seated infections. Hmm? Especially TB. Imagine a person who has multi-drug resistance of tuberculosis. And you know, tuberculosis, we treat them with how many drugs? 4, 5. Rifampicin, isoniazid, pyrazinamide, ethambutol, and streptomycin. Those are the drugs that we treat TB with. And then you have partially taken the medication, and the tuberculosis bacteria that are in you, they come and get resistance. If you imagine what you can get, tell me what you can get. Because now, if you give, you attain resistance of TB, and then someone else get it, this person will be getting a strain that can't be cured by the normal drugs. The TB that you are passing to someone else is a strain that cannot be treated by a normal drug that we give, the ones that I've mentioned. That's why those antibiotics, you'll find them rarely being given to any other problem because of that. Yes, we continue on. You see, the only exception that you can stop the medication, maybe if you have adverse effects. When you have adverse effects, that one we can say no. Now this one is life life threatening. Now we stop. We find a way to treat you. But you see, in another case that I'm seeing, mm, we started by saying prescriptions are written for specific durations. These dose and durations are calculated basing on disease severity, drug half-life. You see, drug half-life means the amount of period, the amount of time that a drug that a drug in your body will be finished halfway. Metabolism will be finished halfway in your body. You understand? That is how we say the drug half-life and the patient's factor. There are some factors that we check before we give you some drugs. Now we continue and say this. We continue and say this. Antibiotics often need the full prescribed. That is the second part. You don't stop your antibiotics, and I've said it and I've explained in a course of tuberculosis. Why don't we stop? Hmm? Fail to fully clear the infection, promote resistance, and the other one is this. Dorothy, sorry, I was calling my colleague, but he's not getting it. Now we continue and say this. In case of resistance, that is a very sensitive case. So we finish antibiotics. Number three, not all medicine are meant to be finished. Why? Why don't we? There are some medicines that we are given and they are not meant to be finished. You see, some medicines like painkillers, some medicines like painkillers, inhalers for asthma, and sometimes anti-nausea drugs. These ones are for specific period. Like if you've been in pain, or let's say a headache because of you have a stomach problem and then you are given painkillers, you can stop them if the headache has stopped. You don't continue with the painkillers unless a doctor has told you you will continue with this painkiller because of this, like paracetamol. You see, paracetamol at times works as a painkiller and at times as an antipyretic. This means it works as it reduces fever. You get it? So if this painkiller reduces fever, what are we supposed to do? To continue with it if we have fever and we are taking other drugs. You get it? Now, anti-nausea drugs, anti-nausea. If you've been having stomach issues and you have nausea and you've been taking a drug and the nausea has gone, you will stop taking these this drug to continue with the other medication. You get it? But now we have some other drugs that are for chronic use, for long time use. These drugs are like, let me give an example of, okay, sorry. Let me give you an example of a drug like hypertensive drugs. You see, hypertensive drugs, diabetes medication, and epilepsy. These are drugs, yes? Alikuwa nataka-
Alikuwa anataka kupima malaria na wale wakamnyang'anya dawa.
Oh, that one you don't. That one you don't do.
Yes.
Okay. So we continue and say hypertensive drugs. You see, when you continue, you start drugs like hypertensive drugs. You start hypertensive drugs. There are so many factors that lead to a doctor to start you on these drugs. Like you start, let's say one of the drugs like enalapril. Your BPs are always high. Maybe genetically in your family, it's a factor, or because due to another complication, you started this drug. So what will happen is you will continue with the drugs, but most of the time, if you know, most of the time, people are attached to a clinic to be going there monthly. Sorry, some Wi-Fi's are low, but we will check and see. Hmm. Yes, yeah. Yes, we continue. You see, a doctor will start you on this drug, but now you will be attached to a clinic. Here in Kenya, you will find that most level 4 hospitals in Kenya, hospitals are in tiers. We have the dispensaries, we have the health centers, level 4, we have the level 3, which are sub-county hospitals, we have level we have level 5 hospitals, we have the national hospitals. So the sub-county hospitals, this is where patients are sent. These patients that are on chronic medication like painkiller, like antihypertensive, antidiabetics, they have a special clinic where they go there monthly or weekly to review the patients and review the prescription according to how the patient is representing. For example, we have a drug called nifedipine. When you take this drug called nifedipine, sometimes it has an adverse effects of swelling of the lips. So when you are given and you start having those adverse effects, when you go, they change. These are chronic medication drugs that you continue with them. Epileptic drugs. There are some people who take this medication for long. You get it? But let's talk about this. Let's take an example of a mother who is gravid. Most of them, they get to get gestational diabetes. And when they get to gestational diabetes, what happens? They are put on methyl dope and sometimes even antihypertensive drugs, other antihypertensive drugs. And you will find that they are given some other anti-hypoglycemic agents like metformin. You get it? So when a mother is given these drugs, what happens? Sorry, forgot to do something. Put, trying to do something. Sorry. If you have a question, you can continue. Just ask any question as you continue. Now, we continue slowly by slowly. If someone has a question, we continue. Very important to understand. It is very important to understand facts when it comes to medication and how you take the drugs. It's very important. So let's not just take drugs for granted, but we should be very curious about and even ask questions when yes, we continue like that. Now, it's very important you ask the doctors questions. Be satisfied and know what drug you are taking, the side effect of the drug, and what you expect from the drug. Because I've met some people that are taking antihypertensives, and funny enough is these people have told me that the doctor told them the antihypertensive drugs will heal them. You see, that is a wrong perception when it comes to drugs. The antihypertensive drugs, they only lower your blood pressure. You check it. And then we have antidiabetics, antihypoglycemic agents. This is for diabetic patients. It is very important to understand that when you take these drugs, you, as the person who is taking the drugs, you may take them for life. Example is a person like diabetic type 1. Type 1, mostly they use these drugs for life. But type 2, I was giving an example before I was cut short of the gestational diabetes. Gestational diabetes, you see, this is a mother that gave birth and because of insulin resistance due to the pregnancy, because of demand, you start having high sugar levels. But when you conceive and you continue taking these drugs, your your blood glucose normalizes. So when your blood glucose normalizes, you kind of like start having adverse effects. When you take the drugs, sugars go down extremely. So should you continue taking these drugs or what? This is whereby we always put these people in clinics, and when we go to these clinics, what we do is we monitor and reduce, adjust the doses, or we stop. But remember, this should be only by the doctor's prescription, by the doctor's advice, not by your word. Like, I'm thinking that my sugars are going so low, so I'm stopping these drugs by yourself. No. Always consult a registered practitioner or a doctor, which is very important. Even when it comes to epileptic drugs, hmm? Encourage. Those ones are drugs that you really need to ask. Those are drugs that you really need to follow up because you have not been having a seizure for so long. You have not been having a seizure for so long. And now you get that you, because you've not been having a seizure for so long, you stop it. Maybe they are the drugs that are stopping the seizures not to happen, because there are some people get these drugs but still they have partial seizures. Consult a doctor for prescription chronic drugs. It's very important. And when you stop suddenly these drugs like hypertensive drugs, you may get rebound hypertension that comes back, and it's a crisis. It's not good. High sugar levels that comes and it's a crisis. This one is not good. So it's good to consult. So the main aim of these drugs, chronic drugs, mostly is to reduce the symptom and make you be in a normal physiological function that will not interfere with the normal life. Because if you don't take like another nifedipine and you are hypertensive, you will have bad symptoms. Stroke is inevitable here. You will suffer brain damage. So it's good to take them. But as you take them, you'll be attached to a clinic somewhere, you'll be attached to a registered doctor or a hospital where you go for monthly checkups or weekly checkups according to your doctor's advice. See, very important when it comes to this. We have seizure recurrence. Seizure recurrence. You take these drugs so well, but it comes to time you stop. You'll start having the recurrence of failures every time. Finishing medicine does not mean ignoring harm. My friend, you see, this is very important factor. When you're told this medicine, you shall finish them. Antimalarial and antibiotics. The medicine you take can have some harm to yourself. Hmm? You take a medicine and then the second day you have a very severe rash. Some people say that doctor wanted to kill me. The doctor wanted to kill me. The doctor gave me medicine that brought me severe rashes. Sometimes you get asphyxia, you get difficulty in breathing when you take the medication. Hmm? Sometimes vomiting, and or jaundice. I saw a post one day online of a person who went to buy medicine for the kid, and he was given a drug called etofilentoin, 100 milligrams for a 3-year-old. That was so wrong. That's a very high dose. So the parent was crying that wherever she gives the baby this medication, the baby vomits and becomes weak and passes out. But the parent continued for some time until he posted this online the third day. You see, that was a very bad move. The parent, she should have posted this the first day and asked. Because some countries, when you go there, some people that dispense medicine is either they forgot their pharmacology that they learned in school, or sometimes they might be not qualified. They just worked in somewhere as an apprentice and then they have started dispensing, which is so wrong. That is illegal. Hmm? Confusion and fainting is a very bad thing when it comes to you take medication and you become confused and you faint. You see, these are things that we should check. These are things that we should monitor when we are given drugs. Severe rash, difficulty in breathing, severe vomiting, jaundice. Jaundice, when I talk about jaundice, I mean yellowness of the eyes and the palms. Why? Because this means when you take that drug, it goes to your liver. When it gets to your liver, what happens? Metabolism starts to happen. It destroys liver cells and you get jaundice. You should go back to the doctor. You should go back to the doctor and tell the doctor that the medicine you gave me is bringing this. Now, there is another funny thing that we always do when we are sick. You find that you are sick or someone else is sick, and mm, and what you do is go for the drug that was left over. That is a very crucial thing to do. Hmm? You think that you are vomiting and you want to take the drug that someone else took because the symptoms are the same. Wrong, wrong drug dose always causes harm to your body. Expired drugs, they lose potency and they become toxic. Get it? Thank you so much for coming to the platform. This topic will continue tomorrow as we talk about drugs and how to take the drugs. Welcome again, everyone.